Well, good morning, everybody. Thank you for being here. Both to those of you in the press and all of our partners here, thank you. And thank you, Vanessa, for putting this together. We're going to talk today about Operation Hope. And my name is Councilor Selberg with the Sioux Falls City Council. I'm going to give you kind of an intro where Operation Hope came from, and then we're going to have some of our partners get up and talk a little bit about how it's tying into their programs as we've moved on. The inspiration for this kind of came out of whether it be through friends, family, or just observation, seeing for a long time that it seems like a lot of people are in need of help, to put it simply. And it's all social and economic classes, at least from the way I've seen it, that you just see a lot of people kind of white-knuckling it through life. And what can we do to help more? What types of, what kind of programs, what could we do as a city council and government to help? Just an example or two, just, looking at these articles like these in the last couple of years. Just yesterday, there was a piece out about mental health holds on record pace, where we see something to the effect of through March, the county has 390 holds, and these are people who are suffering from mental distress to harm themselves or others. So you see stories like that. A couple weeks ago in another publication, mental health care in South Dakota, you may have to get in line. It's about a 5-page article talking about people who need help and can't get it. So those type of stories are things that always kind of hit me and wondered what can we do to help. And then, of course, COVID came along, which pretty much got I think all these issues on nuclear, and just seeing people that are having to be in their homes and not being at work and everything else. And nobody really knows what's going to go on with the world at the time. So we're thinking anxiety, depression, chemical dependency. Now's the time to really focus on it. So there was a One Sioux Falls fund that came out during COVID, and that was there to help people who needed rent assistance. Because, of course, a lot of people couldn't work at the time. And it was a fund that was set up so people could go apply for and get help with their rent. And that's the one where I, in particular, and a couple of us discussed, why can't we do something like that for mental health? So some COVID funds became available, and we were able to get it appropriated $500,000 for this Operation Hope Fund. And again, it's to help anybody with anxiety, depression, chemical dependency in all its forms, whatever it may be. And it can help in any form of that, where if somebody steps forward and needs help, they might need help getting somewhere to a counseling session. They might need help with medication. They might need a ride down to the link. Again, pretty much the instructions were, as we put it together, let's keep an open mind in whatever gets people to take the first step and get them in the right direction. So the goal for this program was always to have a long-lasting, long-reaching program that really moves the needle in this direction. And it's starting to really gain momentum. It's been out there for a little bit. Our first partner was the Link, and they were terrific. They're still with us. But then we've had the Helpline and Avera and Sanford. They've been involved. And the Helpline in particular, I think getting this 988 number and those type things in the last 9 months or so, or was that last July probably, if I remember correctly. Anyway, the idea behind this was to get this out to as many people as possible through as many avenues as possible, and it looks like we're starting to really get some momentum that way. We started with $500,000. It's my understanding we're at about $300,000. That excites me. I think the plan for this money is to see how fast we can spend it, because that means people that need it are using it, and I think we'll find some more. So with that, that's just a little bit of background of the program. We're going to introduce some of our key players here that have spent countless hours in meetings and planning with this and teaming with the city and each other, and I really appreciate their help. The first person that'll say a few words is Alicia Kalura, who is the Chief of Clinical Health Services for the City of Sioux Falls.
Thanks, Councilor Selberg. Good morning, everyone. As he mentioned, I am Alicia Kalura, the Chief of Clinical Health Services for Falls Community Health and the City of Sioux Falls Health Department. So in my role, I oversee the operations of our 4 clinics, as well as for the last few years, I've been the liaison from the city to the link. When Councilor Selberg first brought forward his vision, it was around that time that community leaders were planning for the opening of the link. And that was seen as natural alignment, where these Operation Hope funds could be used to support patients of the link with breaking barriers to care that maybe the link couldn't help with. So things like short-term or transitional housing, transportation, or even co-pays and deductibles to other providers outside of the link. So until now, that's where the majority of the Operation Hope funds have been spent, going primarily to meet these needs through the link. Over time, once those mechanisms and workflows were firmly in place, we began to think about how to scale this fund to help any resident of Sioux Falls, regardless of if they use the link as their first entry of care or not. So over the past year, we've worked with Sanford, Avera, the link, Helpline Center, and the Sioux Falls Area Community Foundation to build a system and a workflow to make that happen. So how it works is any Sioux Falls resident may call 988, and as long as they're not in an immediate crisis, if they have a behavioral health, mental health, or substance use issue, along with a financial need, Operation Hope funding is available to help for that first visit. So if appropriate, based on 988 screening processes, the Helpline Center may refer the resident to Sanford, Avera, the link, or Falls Community Health for their initial visit or assessment. And again, if there is a financial barrier, which could be a lack of income, it could be a lack of insurance, or perhaps the resident has both, but a copay or deductible could cause a burden for their family or themselves as an individual, Operation Hope funds are available for that first visit or entry into care. So in this solution, we were able to take Councilor Selberg's vision and make it a reality through collaboration of our committed community partners. We wouldn't have been able to scale Operation Hope funds to all Sioux Falls residents if it weren't for our great partners that are here with us today. So with that, next I'd like to introduce Janet Kiddims, the CEO of the Helpline Center. She's going to visit about the soft launch of Operation Hope that started in January, as well as how it's helping residents and her staff. Janet?
Thanks, Alicia. As she mentioned, my name is Janet Kiddims. I'm the CEO at the Helpline Center. So the Helpline Center is just super grateful to be part of Operation Hope and to have that as a resource for our callers. We answer the 988 phone number, which has been active since last July. And so it's specifically a phone number for people who are struggling with any kind of mental health or substance use issue or going through some type of emotional distress. So every day, we have people who call us who are struggling with those issues like depression, anxiety, grief and loss, whatever the case may be. And oftentimes when my staff are doing the assessment over the phone and understanding what's happening in that person's life, we determine that the best option for them is a connection to an outpatient mental health provider here in our community. And when we talk with callers about that, oftentimes they bring up barriers with us, like why they can't do that. And many of those are financial barriers because they can't afford to see a mental health provider. They may not have insurance, or they might not be able to afford the copay. So it is just an immense relief that my staff are able to offer Operation Hope to those folks that are from the community of Sioux Falls as a resource. And when we offer that resource to people, the sense of relief and gratitude that we hear over the phone is just absolutely amazing, because they honestly felt like they weren't going to be able to receive any type of support or any type of help. So it has made a tremendous difference already on 988. We did the soft launch, like Alicia mentioned, in the middle of January. So it's been in operation for just 3 months. But already has been able to help so many people. So I am, once again, grateful that the Helpline Center is a part of Operation Hope, and we look forward to helping many more people this year through that program. And with that, I'm going to turn it over to Thomas Otten from Avera Behavioral Health.
Thank you, Janet. Thomas Otten from Avera Behavioral Health. My role would oversee the Behavioral Health Hospital, the Addiction Care Center, and as the Avera Behavioral Health is also the operator of the link. We are thrilled to partner with Operation Hope to cover the needs of behavioral health and addiction issues for people in our community. At Avera, we've been thrilled that the link has been successfully able to operate a workable solution to help individuals on that journey of recovery from substance use disorder. In the past, these folks have often ended up disconnected from the resources that they needed, and they often ended up in places like emergency departments or jails. Now they're getting help at a world-class facility very near here. Working together, the Link Community Triage Program helps better serve people, and it connects them with the resources that they need, and it helps them in a comfortable, world-class environment. Nationwide, there are 15 million people who suffer from the addiction to alcohol. Less than 8% of those ever receive treatment. Sioux Falls is no exception to that sad statistic. It's critical that we remember substance abuse is an illness, not a character flaw. Sometimes taking the first step in that journey to recovery is the hardest, but also the most important step. Many people don't realize that you just can't quit. Once someone is addicted to alcohol or opioids, to feel normal, that withdrawal can be very severe and even life-threatening. Medical care and supervision is often needed to help see patients through that carefully. Behavioral health and addiction issues were very significant concern for our community in 2019, but COVID, as was mentioned earlier, has definitely exacerbated those concerns. Thankfully, Sioux Falls has a wide continuum of places that people can receive help and can receive treatment as we try to break down the stigma around behavioral health and addiction. We have residential addiction care for both adolescents and adults. There's hospital care for severe symptoms of withdrawal. There's outpatient addiction programs in our community. There's numerous outpatient behavioral health care providers in our community. There's inpatient behavioral health. There's 24/7 behavioral health urgent care where experienced team members are waiting for people to come by 24 hours a day, 7 days a week with their mental health crises. And of course, there is the Link, which triages patients 24 hours a day, 7 days a week, 365 days a year to make sure that we can help people start on their journey to recovery. People sometimes see finances as a barrier to getting the help in that first step, especially for those who are underinsured or who have a very high deductible program. Operation Hope breaks down that barrier so people can get on that journey without having to worry about the finances. Just recently, we had an individual who was struggling with addiction. He was on the brink of eviction, and he checked himself into the Link. We used Operation Hope dollars to help him start his treatment recovery and to make sure that he could stay in his home. Now he is back doing treatment and doing a great job of doing that treatment and working instead of being homeless. Operation Hope is changing the trajectory of lives forever. It matters when we break down stigma. It matters when we build world-class facilities to help treat these diseases. And it matters when our community breaks down barriers for all who struggle with mental health and addiction. We at Avera have been very proud to collaborate with the Link and the partner agencies and with Operation Hope to provide a bridge to continued treatment in recovery for countless of people in Sioux Falls. Now, next up will be Ann Hamilton, who is the Director of Behavioral Health Services at Sanford Health.
Thank you, Thomas. As Thomas mentioned, I'm Ann Hamilton. I'm the Director of Clinic Operations for Psychiatry and Psychology at Sanford Health. At Sanford Health, we strive to make it as easy as possible for patients to seek the care that they require. Whether it be emergency care, annual wellness exams, or behavioral health services, we want to remove those barriers that prevent patients from getting the care that they require and that they need. A program like Operation Hope helps patients seek that medical care that they need. We have discovered that transportation and medical costs are two of the biggest barriers for patients face when they are trying to seek health care. Operation Hope helps break down those barriers and makes it more easy and seamless for patients to seek medical care. Behavioral health continues to be a high need in our community, not only in the Sioux Falls area, but also our surrounding communities as well. We want people to know it's okay to not be okay. We want people to be able to seek a behavioral health provider just as they would seek normal care with a primary care provider. Caring for our mental health should not be any different than caring for our physical health. Mental health is health. Sanford has been in the endeavor of expanding their psychiatry, psychology services over the last several years by increasing the number of providers. Additionally, recently we've also launched a virtual behavioral health appointment application on our Sanford MyChart, which allows easier access for patients to establish an appointment with a behavioral health provider. During the pandemic, our providers found that they were able to deliver the same excellent care to patients virtually as they did in person. And patients are really valuing this option to be able to have their appointment from their home. For anyone who's struggling with anxiety, depression, emotional stresses, behavioral health needs, they can certainly self-schedule an online therapy or psychiatry appointment with our new virtual behavioral health platform through Sanford MyChart. No referral is required for this service. And I will turn it over to you, Councilman.
It's okay to not be okay. I love that one. Well, anyway, thank you all for your words and your help, and we're just going to open it up if there's any questions at this time.